words ahead of that, but that's what it is. It's defining what the organisation does, the limits that it sets itself. And these, in turn, are set by external regulations and internal policies. So there are factors affecting governance from without, and there are those which you then implement within the organisation to make sure you keep within those boundaries, within those rules. So you don't need to note down every word, but you do need to understand what governance is, how it operates, it is the operation of the organisation, and how it's affected by external factors, and then that results in internal policies being drafted and kept to. If you ignore the external regulations, you're going to fall foul of external monitoring. If you don't uphold the internal policies, you can become a Bob Diamond who doesn't have a job now. Not that he fiddled it, but his subordinates did. So why is it important? Well, I've told you that. I've told you it's important generally. In the healthcare sector, it's very important because we have a duty of care, ultimately, to the patient. So it's very important in biomedical sciences, which you're now studying, the diagnostic area, but it's also important in industry. And think of pharma here. What's the matter with this guy on the right? What's his problem? Look at his limbs, look at his arms. What's happened to his arms? They're not formed properly, are they? So what was the drug that his mother received when he was in the womb? Thalidomide, 50 years ago. And it's only just now the drug company that produced that drug has sort of apologised for what happened. But it had huge ramifications in the way that drugs are produced. So a whole load of legislation was passed, guidelines introduced to make sure that this type of thing wouldn't happen again. Thalidomide as a drug was quite good, but it was no good if it was given to pregnant women. And the trials had not been done. And so thousands and thousands of babies were born who had malformations to their upper or lower limbs, or both. And they were just fine otherwise. And, it's just very sad that that happened. But to be fair, governments and regulatory authorities and also the drug companies have learned from that. Can't get everything right all the time. We're always learning. Anyway, that guy has achieved a lot, as you can see. So let's go into diagnostic laboratories. Who ultimately sets the standards? Well, I've said, and it's government sets the standards. Government determines, in particular, of course, we're thinking of the UK here, the government of this administration, the alliance government, whatever you want to call it, coalition government, ultimately sets the standards. It says what will be provided, what will not be provided, and it usually does that through cash terms, and it also does it through saying priorities are in this area. For example, a little while back, it was said that if you had cancer, you were referred by your GP for cancer diagnosis, then it had to be done within a certain number of days. So all the NHS had to adjust their practice to that. We have a late rule. The late rule is if you're late, you don't come in. You can come in this time, but in the future you'll be excluded. That's the rule because it disturbs other students who've got here on time. We all have trouble getting in on time. I've had trouble getting in on time, but I did it. You have to adjust your schedule, sorry. Go on to that list and register of practitioners as codes of practice of what you must obey. So this is much more detailed than what the government does. The government sets the big picture, and then down below that you have a regulatory authority such as the Health and Care Professions Council. The Institute of Biomedical Sciences and the Royal College of Pathologists set the professional standards. Yeah, you're very late. So you're the last one in. Anybody else is out. Okay? Get in here at 9, please. So they look after education and training. They make sure that they adjust things year by year so that things are up to date. The whole industry of biomedical sciences, if we can call it that, is very, very rapidly changing. Demands for new tests, the stringency of which those tests are undertaken, the way they're evaluated, it's all changing. And so is the profession as well, because it's changing in the way it's structured. There's a lot of turbulence. I have to tell you that there's always been a lot of turbulence, and there probably always will be. But these bodies, professional bodies, IBMS, Royal College of Pathologists, seek to adjust and meet those changes. Clinical Pathology Accreditation, which is actually a limited company, UK company, comes in and monitors diagnostic labs about once every 3 years to see whether they're following the rules, basically, to see whether they're operating properly. So you can see there's a sort of top-down approach here that comes in to governance in the diagnostic sector. So let's dwell a little bit about the Health and Care Professions Council. It's recently been expanded. It now includes social workers and others in the care area. It used to just be health only. So it regulates 16 professions. Each one of these professions, therefore, has a title to it, a headline to it. So the one for biomedical sciences is biomedical science, and you become, I hope some of you will become, if not many of you will become biomedical scientists in the future. You will be registered at the appropriate point with the HCPC. And once you're on that register, you have to obey the rules. So firstly, you have to show that to get on it, you have to show that you've met the training that's required. So it's a degree, usually, and an Institute of Biomedical Sciences training portfolio. Now those people who are on the applied biomedical sciences degree at this university come in once a week and they do a 4-year degree because they're already employed in diagnostic laboratories. They don't all have to be NHS, they can be private laboratories. But they're already employed, and they are doing work-based learning as part of their degree. That's why it's spread over 4 years, as well as the fact that they have employment, so they can't come in every day. And that includes the completion of their IBMS training portfolio. Once they finish their degree and have successfully completed that training portfolio, they can register automatically for the Health and Care Professions Council register as biomedical scientists. You won't be able to do that. You're going to have to get employment afterwards and complete your training portfolio. But to become a registered biomedical scientist, you've got to do those things. Now, obviously, I encourage you not to be discouraged by that, but to plough on with your degree and to do as well as you can, and to make sure you get as good a grade as you can. And remember, you don't have to work in the national health sector. There's a huge number of opportunities outside of the national health sector. And in fact, those opportunities are probably growing, whereas the ones in the NHS at the moment are quite static because of the stringencies of the financial control that presently apply. Once you're in, You're only in as long as you continue your professional development. So CPD means continued professional development. You also have to abide by the codes of practice that operate within the Health and Care Professions Council. So you have to obey the rules. If you step outside the rules, you can be struck off the register. Struck off the register means you're not likely to get back into the register ever. I'm not saying, well, you might do, but it's a bad day. Bad day. I mean, Bob Diamond's not going to get a job as a CEO of a bank anymore. Okay, certainly not a multinational, and I don't think you get a job in any banking sector again at a high level. It's very difficult to get back in because you've done something that has broken your agreed standards of practice. You agreed to them, you said you would abide by them, and you've not. So continuing professional development, lifelong learning it's often known as, that is something you're embarking upon. Well, you've already embarked upon it. You've done your GCSEs, you've done your A-levels, you may have done other qualifications that have meant that you end up here. Whether you like it or not, it's never going to stop. It's never stopped for me, and as you can see, I've got a few grey hairs now. So until I retire, it's not going to stop, and I hope, in a sense, it doesn't stop then, but maybe be a bit more relaxed. So as long as you're in your professional life, or you're studying, you'll be doing continued professional development. That's seeking to add to the skills you already have and the knowledge you already have. So you're like ascending a ladder or gaining more specialist expertise. It can be broad, go out like that, and in a sense, a lot of what you'll be doing this year and in your degree will be very broad, and then it can start to narrow as you go into work and you get into specialities. You become the expert, but the expert still needs to learn. Okay, I've had the privilege of lecturing in many countries, not because I've been at the University of Westminster, but because I'm recent to the University of Westminster. I have a background in the NHS and I have a background in biotechnology, academia, and pharma companies. In fact, I've worked in China. But you have to continue to develop your professional skills all the time. And even though I may have done all of those things, I still have a lot to learn. And I think that's a good way to approach life in generally. We all have a lot to learn. We should be humble about that and apply ourselves. It also makes sure that scientists are competent and up to date. Well, I've really said that. And in industry, outside of the NHS, where you don't have HCPC registration, you have things called training records, and you have things called appraisals. Anybody know what appraisal is? Okay, appraisal is when you meet with your line manager on a regular basis. It must be once a year, sometimes it's once every 6 months, and you set targets. Go through your learning needs as part of those. And the way it should work is that you actually think about what your learning and training needs are before you go in for that interview. And when you're in that interview, you discuss them and agree them. And if the resources are there, and the time, it's usually time is the biggest thing, then you go ahead and implement those. And then they're reviewed. So it's a cycle. It's not like, oh, well, that's all right, we've ticked that box, go away and do it, and I'm not going to hear from you again in that area. If appraisals are done properly and reviews are done properly, then you'll come back to it. For the NHS, what you have to do is get CPD certificates. So if you go to a meeting, you may get 2 points, you may get 6 points, depends on the meeting. You have a little certificate, you keep those, and you keep them all, file them away, and then at the end of the year you top them up, and you need so many points to keep going. get points for other things, like if you're a member, say, of an editorial board of a journal or something like that. A little way off for you guys yet, but nevertheless, not unachievable in the future. Now, I said that it's not just Bob Diamond who falls foul of things, but I want you just to read this carefully. This is not a biomedical scientist, this is a paramedic, covered by HCPC, and this guy was struck off last month. So just read that for a minute, I want you to take it in. You've got plenty of time. So this guy broke the rules, broke the code of conduct, inappropriate, he didn't supervise safely or give appropriate treatment, he did some other stuff as well, he got thrown off the register. Now you think was this difficult for me to find? No. You go to the HCPC homepage and it has media releases, and this is in the media release. Every person who's struck off gets their name in lights. So do you fancy that, your name, like that? Probably not. I hope not, and I hope it never happened to you. That guy obviously was a publicity seeker. And, well, he wasn't really, he was a stupid man. But, I mean, everybody knows now that Roy Stubbs doesn't have a job. Or at least he shouldn't have a job. I imagine he's lost his job as well. But he struck off the register. He's not likely to get back on. So you have to obey the rules. You have to be within the boundaries. That's governance. Okay? Governance has teeth. The HCPC has teeth. And by the way, on a positive note, if you come onto the HCPC register, everybody can see your name, that you're on there. So you cannot legally call yourself a biomedical scientist unless you're on that register. I cannot call myself a biomedical scientist anymore. I can teach it, I have experience of it, I'm a member of the Institute of Biomedical Sciences, which we'll come back to. I'm a member of the Pathological Society of Great Britain and Ireland. That's a mouthful for you, isn't it? And done this, done that. I told you some of that. But I can't claim to be a biomedical scientist because at the present time I'm not on the HCPC register. And the reason is, and it was my choice to come off that register, I wasn't thrown off it. It's alright, I'm not that naughty. I'm naughty, but not that naughty. The reason I decided to remove my name was because I was not practicing in the diagnostic arena. I'd not been for several years. The rules changed. I looked at the rules and thought, well, I don't really meet this criteria anymore. I've since found out I probably can still be a member, but I haven't got time at the moment to do anything about it. Anyway, so if you're in diagnostic practice, whether it be NHS or private provider, you will need to get this if you want to be called a biomedical scientist. And once you've got it, don't lose it, as Roy Stubbs did, of being chucked out of his particular area. Not the biomedical science, paramedic area. So there's some key publications. You can get to the HCPC website very easily. Just type in HCPC or Health and Care Professions Council. So you might be interested on the one on the left, top left, guidance on conduct and ethics for students. The one on the bottom left is really more about for educators, like the University of Westminster. And then you've got continuing professional development on the right. These are fantastic little booklets. They are so easy to read. They're so straightforward. I mean, unfortunately, you're going to read a lot of complex stuff over your career, some of which will send you to sleep readily. Honestly, well, you don't need any sleeping tablet. It will do the job. Okay, you'll be there. It doesn't matter what time of the day either. You'll be off. Guarantee it. All right? And it's usually free because you can download it. Okay, so you don't worry about going to see the doctor or anything like that. Just get one of these long documents. But these ones are short. I'm afraid they'll keep you awake because they're very to the point. They're only about, I think they're about 14 to 16 pages long each. Just brilliantly written. I wish all documents could be that succinct, but they're not. Sorry, you have to get used to that. That's part of continuing professional torture. Okay, it's the long document. And governance does stack up lots of information, lots of paperwork. So go to the website and say, download yourself a copy of PDF of the top left and the top right. You may want to look at the other one as well, just to check out that we're doing our job properly, okay? So you can report on us if we're not, okay? I didn't say that, by the way. I deny it. Okay, so what about this degree you've just embarked on? And I wish you all the best with it. It's going to be hard work. Hard work's already started, you know that. Bad news is it's going to get worse. But if you're interested in the subject, you'll do well. Okay? That's the key thing. If you're interested in something, it's not work anymore. I wouldn't say it's pleasure always, but it's not work. So, the biomedical science course here goes back to 1992. Why 1992? Because in 1992, you've probably been told many times, this institution became a university before it was a polytechnic. And the polytechnics were 7 years, many, many years. Academia, that is, people in universities look down their nose at polytechnics. So for vocational or applied training is not really where it's at. You need to be more academic, you need to be more theoretical. I think that's a load of trifling stuff. But everybody fell in, you know, one domino falls, they all fall. And so every institution that was a polytechnic became a university in 1992. It doesn't mean to say that biomedical sciences was not being taught before then. For example, in the 70s, I did my HNC, High National Certificate, at Harrow College for further education, which is now part of this university. Then I did my fellowship at the Institute of Biomedical Sciences in the late 70s at Paddington College, which is part of this university. But what happened in 1992 was things changed organisationally. So every 5 years since then, the course has had to be revalidated. And it's been scrutinised by the HCPC and the Institute of Biomedical Sciences. The last review, therefore, was this year. It was in March this year. Huge amount of work went into that. Very, very important, you see, because we're under governance. What's happening is there is external monitoring of us. Is our course delivering what it should do? So that you can be confident when you get your degree that we're doing the right thing. We don't do it perfectly, and no organisation will work perfectly. We strive to do things properly, okay? And that's why we always need your feedback. You've heard a lot about this, haven't you, student feedback? You've heard something about it. We need it. We need to know what we're getting right and what we're getting wrong. We are often painfully aware of what we're getting wrong, but we need your feedback to put it in perspective, and also your suggestions to how we can improve. And that's all in this revalidation. The external people, the HCPC, the IBMS, look for that. They look for, say, what is your feedback? What is your annual monitoring? How do you assess how you're doing with your your degree from year to year at each level. How many students are progressing? How many students are having difficulty? Not individuals. So it's very, very important. Now also, I have the job of completing the annual monitoring forms for the HCPC. So they're once a year. And believe you me, you end up with about a stack of information that big. All right? It's heavy duty stuff. I don't know whether it works like the more you produce, the less likely they're to read it. I don't think it quite works like that. But I hope it doesn't. But there's a lot of stuff they ask for, and they ask also for a sort of headline statement, about 5 pages, where you go through and you say, have you met this standard? Are you meeting it? Is there any changes? If you don't change something, you don't have to put it in, but if you change something, you do. So we are regulated as well. We're under governance. Okay, so as I said, it's going to affect you all. It's affecting you now. How many of you signed up the sort of pact for learning? You know, I know it's not called that, but you know, there's a sort of an agreement between you and the university, the way you're going to learn. How many have signed that?
What?
1 or 2? If you haven't heard about it, then I suggest you ask Carol. but I mean, basically, there's a kind of two-way contract. Yeah? All right. Don't get too disturbed about that. If you haven't been given it to sign, don't worry about it. You probably will. Okay, professional bodies. Let's quiet down a bit. There are 2 professional bodies that really influence the governance within this area, biomedical sciences. The first one is the Institute of Biomedical Science, which happens to be 100 years old this year. And no, I wasn't a founding member. Okay? I deny that categorically. There's their website. It's been revamped now, so it looks good. It looked trashy before, until about 2 months ago. It reminded me of Chinese websites, where the only thing that was missing was a floating image coming across the street. So I got used to that in China. It's just a different culture, a different way of working. I'm not knocking it. I've got to be careful. I've got to be PC. That's important in this governance arena. PC for the right reasons, not for the wrong reasons. Everybody should have a voice, and everybody should have some flex in how they feel. So you've got the logo, and you've also got the crest, and the bird sitting on the top of that crest is the liver bird, because the Institute of Biomedical Sciences, in a different name, started off in Liverpool in 1912, 50 years before the Beatles. Anybody remember the Beatles? Anybody like the Beatles? Yeah. Well, I would, wouldn't I? Anyway, they started off in Liverpool. And you notice the serpent in the middle. That's always a sign for medicine, isn't it? And the writing at the bottom, which is in Latin, is basically, learn that you may improve. It's a good motto, isn't it? Learn that you may improve. Now, I don't know much. I'm a member of the IBMS, of course, and I have been for nearly 40 years now. But the one at the bottom, I can't take you through that crest. That's the Royal College of Pathologists. Now, pathologists have been around a lot more than 50 years. Okay? A lot more. But they became the Royal College of Pathologists in 1962. So they happen to celebrate their 50th anniversary this year. Now, the Royal College of Pathologists is the body that medically qualified pathologists belong to. So these people have taken their medical degree, they've done 5 years, hard slog on that. Then they've done many years of extra training before they become members of the Royal College of Pathologists. You won't find, I don't think you'll find any members of the Royal College of Pathologists below the age of 30. And to be a consultant pathologist, you're probably talking about 35. Once you're a consultant pathologist, you have a good salary, very good salary, and good pension at the moment, until the government changes it again. But you have considerable responsibility, because ultimately the diagnosis of the patient in the pathology lab is in your hands. Now, I'm not saying that biomedical scientists don't put out results. There's a difference between putting out results and actually saying this person has this. So there are checks and balances within the pathology laboratory that make sure that the results that go out are accurate. We'll come back to that in a minute. Now, these professional bodies, in terms of setting standards for governance in training, education, continued professional development, they work together. The Institute of Biomedical Sciences takes the lead, because we're talking about biomedical scientists. But the Royal College of Pathologists has an input as well. There's collaboration between the two. And that's very important. Don't expect you to remember this. You'll get it as a note at some point, but I've put in red those things which perhaps trying to highlight the rest of the statements there. Actually, I've abridged this, so it's a bit longer than this actually. But if you are a member of the Institute of Biomedical Scientists, you can be a student member, an associate, a full member, or a fellow. Then you need to abide by their rules, and they have a code of conduct. And again, if you break everything, you can be thrown out. Thrown out of membership. It doesn't probably stop you from practicing, like the HCPC. But it's not a good day if that happens. You notice 4 and 5, something we're not touched on so far. And that is recognised beliefs and values of the wider general public. So you've got to be careful in the way you handle things. We all come from different cultures, different backgrounds. And we've got to remember everybody else does as well. So everybody has to be treated with respect. Everybody has to be acknowledged as being on the same level as everybody else. So that's in 5 as well. You see again, CPD is there in 6 and so on. But I'm not going to dwell on this because it will take a long time to read it. But it's 8 statements that everybody signs up for who is a member. Right, clinical pathology accreditation. So, you've got your governance principles in place. Everything is in place, and you know what the HCPC expects, and you know what the IBMS expects. You have reviews with your employer, your line manager, you have all these sort of things that are there, and you do have those in the diagnostic sector as well. You hopefully have your degree, so you remember, or you're on your way to that, so you have a learning contract and so on. But we're nearly at the end of the first bit, which the second bit is a lot shorter, which is how is this all monitored? If you are a diagnostic laboratory, whether in the NHS or in the private sector, who comes in and validates and assesses and monitors that you are doing what you say you're doing? Well, it's Clinical Pathology Accreditation UK Limited, CPA. They come in every 3 years. They can come in more often if they think there's something wrong. And they will come in and they will assess the organisation as a whole. Now that is very useful actually. I mean, everybody has a certain fear of being monitored. Okay, you know, let's see what you're actually doing. You say you're doing this, now give me the evidence. But actually it can be very helpful. For example, if people are struggling with training budgets and stuff like that, they will come in and they'll say, yeah, you're doing all right, but your training budget's too small. There's not enough people being trained for specialities here, and so forth and so on. It has to be patient-led. You don't just get training because you want training. It's got to be patient-led. That's right, isn't it? I mean, if you're the patient, that's the way you want the money to go. And you don't want to go just because, well, I'd like to do this course, please. So, members of the IBMS, members of the Royal College of Pathologists together come in and they audit, they look at, and they assess, and they monitor on a regular basis whether these laboratories can maintain their CPA status. I'm not going to go into that. You can go to their website. I actually find their website very irritating because you can't find the rules and regulations easy. You have to go to another website to find that. Sorry guys, I forgot what that was. But I'll try and put a PDF of that booklet, okay? That is a cure for insomnia, okay? But you know, the managers have to look at it and they have to make sure they tick all the boxes. Health and safety is included in it many times as well. I'm not going to mention health and safety again, but health and safety is part and parcel of the duty and responsibility the employer has to you in the workplace. It's also your responsibility, as I'm sure you've been told already, your individual responsibility to make sure that you don't do things that are unsafe, that will jeopardize fellow students or fellow colleagues. Right, to finish off then, we'll come back to industry right at the end. So. But this applies to industry and it applies to the diagnostic sector. Internal governance then. So how do you make this all work? I said you've got to have an action plan. You've got to be able to make this all work within your organisation. Well, the first thing you've got to do is you've got to listen to the customer. Who is the customer in the NHS? Patient. No. Who is the customer? You're wrong. It's not the patient. Who is the customer? The ultimate customer is?
Employees.
Who?
Employees.
Sorry. Can't hear. It's the government. The government sets the boundaries. Then, below that, you have the hospital, and within the hospital you have patients. And the patients do, and it's true, so I'm a bit naughty, they do expect a standard of service, and they have a right to expect it. But ultimately it's the government that says, you will provide this. Okay? Are you in for the next lecture? This lecture, well, you're about 45 minutes late. Next time you won't be in.
I had an appointment.
Yeah, okay, alright. We've all got appointments. I hope you've got mitigating circumstances for them then. Okay, let's carry on. So it must operate at all levels. And therefore it must be linked up, joined up, links in a chain, interwoven circles if you like, whatever you want, whichever way you want to pictorially display it on your part. Now you've got to regularly review it against internal targets. Are you meeting those targets? Not just say, we will do this, but we have done it. We can monitor it. And certainly in the NHS, there's a lot of change always. And it's never been different, actually. So things can quickly change. And you've got to respond to those. You don't just wait for the next monitoring. You respond to them immediately. If the government comes out with a guideline or NICE, National Institute for Clinical Excellence, you've got to respond to that, okay? can't just say, oh well, we've just passed our inspection and we've got our accreditation for the next 3 years, so it doesn't matter. It does matter. Because these directives are coming in from the government or from other government bodies that are saying you should implement this practice. Now this looks complicated, it isn't really. It's also got, interestingly, because this is a quality management thing I got from the internet, it's actually got a spelling mistake on it. Work. It's just to emphasise how hard work can be. Alright? I just saw it last night and thought, crumbs, I did not spell that right. Even I can spell work. I can't spell many long words, but I can spell work. So what you basically have is policy documents at the top level. The big picture stuff. The type of thing that senior management look at. So you have your quality modules or operating modules, manuals. You have your policies and guides. Then, level 3, it really starts hitting you as practicing biomedical scientists in the future. That is, you have standard operating procedures. Has anybody come across that term before? Okay, well it means you do something, it's usually a method or a procedure, you do it in the same way every time. Now, what happens if the SOP is wrong? Well, you do the same thing every time and you get the wrong result. Alright, it's not rocket science here. That's why they need to be reviewed as well. So, if you're in a work situation, you come across an SOP and you say, that's not right. That doesn't. You go into laboratories and the people who use the standard operating procedures and the guy who's training you say, well, we don't actually do this bit, we do it like that. That is actually non-compliant with the SOP. So it needs to be changed. Good laboratories, it will just come up automatically. Everybody will have that freedom to input into change. Because nothing is ever perfect. There are always things to learn. And right at the bottom you have lots of forms, lists and records to prove that you've done things. Okay? So that's quite a nice pyramid, the way things go. You get more documentation as you go lower down the pyramid. Most of us would be involved with level 3 and level 4. And I've already said this, but there's also something called a quality management system or quality management cycle, which means that the whole thing is not static. So you can see it goes around in this circle. How we improve our services, how we deliver our services, how well we deliver, how we deliver our services, how well we deliver our services. I'm not sure I like that anymore. But anyway, forget, I'm not sure if you put that right. But what it means is you take stock of what you're doing. You change it. Okay. Maybe you can make better sense of that circle than I can. But it means that something is dynamic. It changes. So then you've got, what is your quality? Quality is part of your output. How do you measure things? How can you be sure that what you're delivering is good? Well, you have quality control, which is internal and is driven by standard operating procedures. So the procedures will say, you need to put these particular controls in this method, and if they come out within this boundary, you're okay. If they don't, you've got to do the test again. You have positive controls, negative controls. You'll be familiar with this. Bye-bye. Equipment monitoring. So how do you know your refrigerators are operating between +8 and +2 degrees? You don't want to freeze things that shouldn't be frozen, and you don't want things at room temperature that that should be in the refrigerator. So you have logs, you have alarms, and so forth. Reagent control, chemicals that you make up. Now, a lot of stuff is now provided in kits. But how do you, if you have a problem with a kit, how do you know when that problem occurred? You keep records of the kit that you used and the lot number. And if you make reagents up, which you certainly will here, you should make them up according to stringent rules, and you should date them, you should record that you made them, you should have an expiry date on them, you should have a temperature of storage. Is this important? Yes. Absolutely it's important. Because if you go and work in the NHS or you go and work in industry, you've got to be sure that the reagents you're using are current and correct. If they're not, you're going to get the wrong result. Now, quality assurance is something different. Quality assurance is when you participate in an external scheme. So you get samples to analyze periodically, and it's to test that you can meet the level of proficiency that is expected. So you meet their key performance indicators. And there are a number of national schemes in this country. Good number, actually. And they've come into being over the last 30 years, 30, 40 years. They started off really in clinical chemistry, and they've migrated into all the disciplines. So we have the National External Quality Assessment Scheme, called NEQAS. So they have a primarily educational role. That's the first and foremost thing they're there for. So don't always expect to get the right result, especially when you join a scheme, because it may be that you're just starting off to employ a technology for diagnostic purposes. But the idea is that if you're below the level which is acceptable, educational measures will be put in place to help you go above that level and to consistently achieve above that level. If people couldn't care less, if people join, they get low scores, bad results, then at the end of the day they can be prohibited from providing a patient service in that area. That's right, isn't it? If you're a patient, you want to know that your test is going to be done properly, don't you? I do. And we trust these guys, don't we? We have to. You can't be in the lab saying, well, that's my blood sample. Excuse me, I just wanted to check you've mixed that before you put it in the analyzer, all right? You wouldn't be allowed to get in. And they wouldn't like it. So UK NEQAS, the statement here, the website's very informative, better than CPA. Perhaps I spent more money on the web design. But anyway, it's talking about education, promotion of best practice. But there are teeth to this organisation. Now, my discipline is histopathology or cellular pathology. And there are two general schemes that nearly all labs have to participate in. And then if they're doing specialist investigations like breast pathology, and that is to determine whether a patient should have, say, Herceptin as a drug because they have breast cancer, or estrogen, progesterone, i.e. hormonal therapy, and they have to be able to do those assays properly. And that is one of those schemes where if you fail, for more, I think it's more than 2 times in a row, they will come in and investigate you. They'll come in to help you, but if you can't improve, you're off, and you can't offer that test again for a while. Not forever, but for a while. The other 3 there are more prospective. They are voluntary, and they're to help you improve practice in areas which are quite specialist.
But you'll get these whether in clinical chemistry, hematology, microbiology, immunology. They'll all be there. So I want you just to go away with the thought that there are general schemes which every lab should be part of. There are specialist schemes which depends on you offering a specialist service. Last slide. Standards for industry. Well, I could talk a lot about this, but I'm not going to because I've only got 5 minutes. How do you know that your drug is safe? How do you know that your drug that you spent $1 billion producing over 10 years is actually going to do the job? That's why pharma companies are struggling. It costs $1 billion to take a drug from an idea to market. So there aren't many that get through. Loads and loads get lost on the way. And one of the reasons to get lost is because of these rigorous practices called GXP. Good X practices. Now these are defined they run internationally and they regulate drug development. The idea at all times is to protect the potential patient. That's the primary thing. The secondary aim is to show that your drug is actually worth being put in patients for treatment after its launch. Let's go through this in order. Thalidomide was one of the reasons why these GXP practices are here and why they're so well developed now. Another reason is that people actually cheated, drug companies contract houses, not drug companies, contract houses cheated when they were subcontracted to do work. For example, clinical trials discovered in the mid-70s where the guy who was monitoring a clinical trial, going into monitoring what was happening in his contract house, he actually went out for the lunch break, and as you do, you walk around a cemetery, don't you? And he did, and he found all the names of the people that were down as part of this clinical trial were actually people who were dead, and their names were on the tombstones. Not good. Not what you want, is it? If you're the receiver of that drug at the end of the day. Anyway, let's come back from that. Good laboratory practice. This happens before the drug goes into humans. What you do is preclinical testing. For example, I've been involved with this. You have an antibody that you think will treat a certain cancer or a certain inflammatory disease. Antibodies, you probably know, are sort of lock and key things. So, how do you know that your key, antibody, is going to just react to the lock in that particular cancer or that particular pathology? Well, you get tissue sections and you put the antibody on all these tissue sections from different parts of the body and see whether it only links to those organs or tissues that you think it should. Okay? If it doesn't, you get worried, you have to explain it away. It doesn't mean to say the drug's finished. This means you have to be careful that you're not administering an antibody for one disease and knocking out the person's liver at the same time, which would not be a good thing. So that's preclinical testing. There's good manufacturing practice, sort of combines with that to some degree, but it comes in much more importantly later. And that is that your quality spec for your drug is always the same in manufacture. So it's pure and it's potent. It does what it's always the same as what you say it is. Good clinical practice, and this is where Jeffrey's going to take over in a minute, because you can talk about ethical things, is making sure that whether you're using healthy volunteers for the first introduction of a drug just to assess its safety, that they are consented to this and the protocols are done properly so you don't endanger the person's lives or the person's lives. And then, of course, you need informed consent for patients who maybe are receiving experimental drug, often very ill patients that are otherwise going to die. They've tried everything. But they still need to give you the permission to allow the drug to be administered. And that goes right back to the Nuremberg war trials after World War II, when, of course, a lot of experimentation was done in World War II without any consent whatsoever by the Nazis. And dreadful things were done. And it's developed from that. And I know Jeff is going to touch on that. So that's it. It's 1 minute past 10. Apologies that I'm 1 minute over. That means I can escape without questions. Unless you have any, I don't know whether Jeff, will you give me 2 minutes for questions? Or even 3. Anybody got any questions? Anybody suitably scared by governance? Well, you should be. You're